The adult disability services cover two main areas: learning disability and physical disability. Within each of these areas, there are a number of teams that work closely together in an integrated and multidisciplinary way. Community-based: behaviour management services, crisis response and home treatment, forensic services, supported living, and transition teams. Physical disability teams: community-based, physical and sensory support, sensory and disability services, residential and nursing care, brain injury team, supported living, and transition teams. The adult physical and learning disability teams have key pieces of legislation, policies and procedures which govern the work of the adult disability services and inform your role and interventions with service users, carers and families. This is by no means an exhaustive list, and there are a range of other policies and procedures which you will become familiar with through your daily work. There are a number of community-based multidisciplinary teams across the Southern Health and Social Care Trust for both physical and learning disability. These are located in various sites in Newry, Armagh, Portadown, Craigavon and Banbridge. These teams are supported by more specialist services and are based in a variety of localities throughout the Southern Health and Social Care Trust. Teams within disability services will include a number of staff: team manager, administration support, social workers or case managers, social care workers, physiotherapists, occupational therapists, AHP assistants and nurses, psychologists and psychiatrists. This list is not exhaustive and may include other professionals to meet bespoke, complex and more specialist needs of some service users and their families. You will become more familiar with and aware of such services in your day-to-day work. The aim of this service is to maximise the potential of individuals with physical and learning disabilities and their carers by working in partnership to enable choice, independence and promote social inclusion. Respecting the rights of people with disabilities and their families, adult disability services endeavour to work safely and innovatively using a multidisciplinary approach. Working within these teams may involve liaising with a number of other services, teams, agencies and voluntary groups. Some of these will include AHP and medical professionals, specialist teams, specialist services, condition-specific specialists, housing associations and supported living schemes, the trust care and private care agencies, the palliative care team, the integrated care teams and crisis response support and recovery, home treatment. The list is not exhaustive and there are a range of other services which you will become familiar with through your daily work. To receive support from the learning disability team, service users must meet specific criteria. The individual must be aged 18 years plus and living within the Southern Health and Social Care Trust. They must also have a formal learning disability diagnosis by a psychologist, which significantly reduces ability to understand new or complex information, to learn new skills, impaired intelligence with a reduced ability to cope independently, impaired social functioning, which started before adulthood. Other specialist services may have their own referral criteria, which you will become more familiar with in your own daily work. There are three main levels of learning disability: mild learning disability, moderate learning disability, and severe learning disability. Service users may also have dual diagnosis, such as mental health, physical disability, or dementia, but are still supported under learning disability services, with possible co-working across multidisciplinary and programme of care teams. Referral to these teams come mainly through psychologists and may include young people moving from children's to adult learning disability services through the transition teams. To receive support from the physical disability team, service users must meet specific criteria. They must be aged 18 to 64 years and living within the Southern Health and Social Care Trust, who have a physical or mental impairment which has a substantial or long-term adverse effect on the ability to carry out normal day-to-day activities. Other specialist services may have their own referral criteria, which you will become more familiar with in your own daily work. Remember, what is substantial to one person may not be to another. This will be assessed in partnership with the person and/or their family. Again, some service users may also have dual diagnosis, such as mental health, which may require co-working across programs of care. The main types of physical disability include neurological conditions. This can include multiple sclerosis, motor neuron disease, Huntington disease, Parkinson's disease, epilepsy, congenital disabilities. This can include spina bifida, cerebral palsy, traumatic disabilities. This can include spinal injury, amputee, brain injury. Referral to these teams can come from various sources to include self-referral, hospitals, GPs, district nurses, allied health professionals, carers, public representatives, voluntary agencies, other social work teams. There are a range of services that disability teams provide. Please pause this video and take the time to read what is on the screen. The strengths and skills of working within these teams is based on person-centered approaches, developing services tailored individually in partnership with service users, carers, etc., having a skilled, flexible and innovative workforce committed to service development, strong value base, respect for individuality, non-judgmental, empowerment, right to self-determination, good working relationship with carers, excellent team working. For more information, please research the following links, which can be found in the accompanying training Word document.